Thank you everyone for attending. So Northern Light Health, um, we are the second biggest healthcare system in the state of Maine. We're the most expansive integrated healthcare system in Maine because we provide services to all 16 counties in Maine, and we have 10 hospitals under our umbrella. So we have hospitals from Portland to Presque Isle, Maine, all the way from Blue Hill to Green Hill, Maine. Um, in our 10 hospitals, we have right around 987 licensed beds. Um, and we have 5 emergency transport members. So we have 5 different EMS organizations that hire for paramedics. And we have 37 primary care locations. And we're right around 12,500 employees. So we're pretty big. Um, and I always like to kick it off with our mission because to me, that's the most important thing. That's what's drawn me to Northern Light Health and why I've been here for 4 years. I started out as a recruiter, and then last year I was promoted to the manager because the mission is what really drove me to stay. So our mission is Northern Light Health exists to make healthcare work for you. We improve the health of the people and communities we serve. And that's our mission and that's our purpose. And for me, it's simple, but it applies to everybody because we all use healthcare and we all need it, especially in Maine, where Maine is one of the older states. So healthcare is more pivotal, I think, because of that. Um, so what we're looking for, right now we have about 800 jobs posted, so very daunting. We have jobs from patient service representatives. So when you go to a doctor's visit, so the person that checks you in and checks you out, that's a patient service representative, all the way to surgeons, and then everything in between. So we have quite a few jobs open. And if you want full-time, part-time, per diem, so basically on call, and any schedule in between that you're looking for, the opportunities out there because of how much we have open. And the nature of that is being so big. That's part of the reason we do have so many openings. And we have all kinds of different areas. A lot of people, when I first got out of the Army, I'm like, there's no way I'll get into healthcare because I don't have that background. But, there's people that have to support our clinical folks. So nurses and the doctors, you're going to need the finance side, the supply chain side, our IT side, clerical. We have various leadership roles that are non-clinical leadership roles. And then, of course, we have our clinical roles, which makes up about half of the organization. So some of the great benefits that we have that a lot of places that I think we have a leg up on is we offer full-time benefits for part-time. So as long as you have a 16-hour to 35-hour schedule, you get part-time benefits. And that includes everything. So medical, dental, vision, paid time off, retirement, life insurance. And then for our full-time, it's 36 hours to 40 hours a week to get the full-time. Now, our paid time off, I really think it's great because it's an accrual system, so you earn time off for time worked, and you start accruing from the day you start, and you're eligible to use your time off from the day you start as long as you have it accrued. So I think that's a difference from a lot of places that you have to go through a 90-day probation. We allow it from the start as long as you have it accrued and it's approved by your manager. And with our paid time off, you can accrue up to 400 hours, which is a lot of time accrued off. That's 50 days off if it's an 8-hour day. And so we have a very generous paid time off package. Now we have medical, dental, and vision. I think our medical is fantastic in the sense that it's a self-insured plan. So we don't go through like Blue Cross or Anthem or anything like that. It's an employee-driven medical plan. So the organization pays 80% of it through our, and then we pay 20% through our premiums. And the big thing that I like with being on a self-insured medical plan is you get discounts for going to our doctors or our hospitals. So that's nice. You get discounts on services because depending on the service, it can be expensive. And of course, you get dental and vision. So if you're working part-time, 16 hours, you're going to get medical, dental, and vision, paid time off, retirement, all that stuff, which is I think is great, and it's a great benefit that we offer. And so with that, we offer life insurance 1.5 times your salaries for free, and you can do up to 5 times your salary in life insurance up to $1 million. So I like that. We offer free short-term and long-term disability. It's free for everybody on short-term except for the unions. We have some unions part of our organization, so the unions, it's paid out a little bit differently. We offer tuition reimbursement, which is great. You just have to be with us for at least 6 months before you're eligible for tuition reimbursement. For full-time employees, it's $3,000. For part-time, it's $1,500. And it's based on the budget. So as long as it's budgeted, you'd be eligible and you're in good standing as an employee. Our retirement, we do that through Fidelity, and we do matching up to 2% once you've been with us for 1 year. And another big reason I've been with Northern Light Health for almost 4 years now, and it's flown by, is we have a very supportive culture on self-development and growing our own employees. And right after I joined Northern Light Health, we signed an agreement with Husson University. We have a professional and organizational development program that we partnered with Husson University. So they have professors that come and teach, and our employees can apply to this program. It's a year-long program from September to August. And it's once a month, and you can apply to it as long as you've been with us for at least 6 months as an employee. And they teach you everything about healthcare, and then the professors come in and teach you different parts of professional development. That I went through the program. I thought it was fantastic. We also have a mentor program that all employees are eligible to go through, and they do it kind of differently. You think of a mentor that usually someone within, if you're an HR or if you're a nurse, it's with a nurse. We do it a little bit differently. I went through the mentor program, and I was paired up with a physical therapist. And of course, I'm not from the clinical side of it, so I didn't know a whole lot. And it's been fantastic to learn about everything she does as a physical therapist. So it gives me a broader knowledge on healthcare. We also have a lot of great opportunities. We have on-the-job training programs. So we build our own. We have a medical assistant program at our A.R. Gould Hospital in Presque Isle. We have several CNA programs that you can apply to. We pay you to go through it, and we help you get licensed at the end of it. We have a phlebotomist training program right at Eastern Maine Medical Center that's going on right now. We're taking applications, and you get paid $15.26 an hour to go through the whole phlebotomy program. We train you to be a phlebotomist, and we help you get certified. We also have a Work to Grow nursing program. So if you're enrolled in a nursing program, you can apply to this program, and we'll pay you up to 40 hours a week for your school time. And then whatever's left over up to that 40, we'll have you work at the hospital, and we'll pay for your education. So those are a lot of the big highlights. And I'll pass it back over to Sarah if anyone has questions.
Thank you, Matt. And thank you to Northern Light Healthcare and JobsInME.com. And I hope you have a great rest of your day.
Thank you very much, Sarah.